Good afternoon, everyone. My name is Rick Fessler. Today I'm going to talk about my clinical results and the biomechanical results of a novel 3D expandable cage for lumbar interbody fusions. These are my disclosures. One is significant. I do teaching and education on this device. So this device is an interesting device because it satisfies all the criteria of an anterior lumbar interbody fusion in terms of its positive things, and it also eliminates one of the negative things, and that is incising the annulus anteriorly. It's put in through a TLIF, a transforaminal lumbar interbody fusion, that is now the most commonly used approach to lumbar fusion. We've been doing it a long time. It has a long history. It's been very well studied, very well understood, and you can do it either open or minimally invasively. So this is an interesting device in that this is the initial discectomy device. We'll talk about that a little bit more later. But as I said, the Luna gives you the smallest incision. It's done through a 4, 5, 6 millimeter annular incision through a transforaminal lumbar interbody approach. But it gives you the coverage of the end plates as though it's an ALIF. Did that go back? There we go. It's very easy to put into the disc space, very consistently deployed. It gives you a large graft window for your fusion. It gives you excellent restoration of your height, and it gives you lordosis in the lordotic cages. And you can do this all without retracting the nerve roots or the dural sac. So in its biomechanical testing, the Luna device had your typical banana cage as the FDA predicate. The banana cage failed at about 574 newtons. The Luna failed at twice that, so it was twice as strong in resisting subsidence. All the other tests for the FDA were equivalent for static and dynamic axial, torsional and shear, and for expulsion. So when we did our secondary testing in the laboratory of Pat Warden at Loyola, what we found was that this device, Luna, was statistically equivalent in flexion, extension, lateral bending, and axial rotation when a compressive load was put on. But when there was no compressive load, it was actually superior to an ALIF in flexion and extension. So in conclusion, this TLIF delivery device of Luna is equivalent to or better than in reducing intervertebral motion than an ALIF cage. So it was better than its predicate through a TLIF. It was better than the predicate through an ALIF. In my study, I have done roughly 100 patients now. About 50 of them have reached 1 year, and those are the patients I will report on today. In those groups, whether we used a lordotic cage or a straight cage, their preoperative segmental and lumbar lordosis was not significantly different, their disc height was not significantly different, and their back pain, leg pain, and oswestry were not significantly different. What we found postoperatively, following them out to 1 year, however, was that whether we used a straight cage or a lordotic cage in either segmental lordosis or in global lordosis, lordosis was maintained excellently by either one of those cages. What really did change in this group was disc height. Immediately post-op, and that was maintained out to a year, whether we used a segmental or a lordotic, or whether we used a straight or a lordotic cage. And those were highly statistically significant from their preoperative values. In terms of their clinical results, back pain, whether we used a lordotic cage or a straight cage, was significantly improved. Leg pain was significantly improved, and oswestry disability was significantly improved in all cases, but they were not statistically significantly different from each other, whether we used a straight or a lordotic cage. So this is what the device looks like. This was Gen 1 lordotic cage in the AP and the lateral. And this is what the CT scan looks like. You can see how nice of an excellent space we get for our fusion. This is what the lateral looks like for Gen 2 or XD with a pedicle screw system. And just to tease you a little bit, this is XD with what I believe is going to be the next generation in lumbar stabilization. So in conclusion, biomechanically, the lumbar cage performed equivalent to or superior to its static predicates, whether that was ALIF or PLIF. At 12 months, lordosis was maintained or improved equally with either a lordotic or a straight cage. Back pain and leg pain were equally relieved, either lordotic or straight cages. The critical factor in patient outcome appears to be not lordosis in 1 and 2 level degenerative disc disease, but restoration of disc height and therefore foraminal height. Thank you.